Hey, it's Dr. Bob. Welcome to Conquering Migraine. Today, we're going to talk about red flag. So a red flag is something that means that we should worry about a serious underlying cause, like an infection or a stroke or a brain tumor or an aneurysm or something else serious, either systemic or neurologic. My headache teaching, I use the standard headache acronym SNOOP P4. And so SNOOP P4 stands for some of the kinds of things that we don't want to miss in headaches. And so the first one is if somebody has any systemic symptoms. And so systemic symptoms might mean they had previous cancer, might mean might mean they have fever and a stiff neck, or they've got chest pain going up into the neck and the head. And so those are signs that there's something larger going on and we should worry about the head. So for instance, let's say somebody's got HIV and they're having fevers. Well, then they could have fungal infections or parasitic infections or other kinds of bacterial infections in the brain causing meningitis or meningoencephalitis, which involves the brain and the lining of the brain. So those are signs that something more serious is going on. So that's systemic symptoms and history of systemic problems like cancer. Then the N is for neurologic. So if there are neurologic symptoms like localized things like one eye droops or one arm won't move, or there's new onset slurring of speech. So not just aura symptoms that in the same person repeatedly precede the headache by an hour or within the first hour the headache can go away, but new localized headache symptoms is a problem. And then on rapid onset. So typically that's less than 60 seconds, and that's called a thunderclap headache. So it's like wham, you just got a severe sudden onset headache. And that's a ruptured aneurysm until proven otherwise. There are other kinds of spasm in the head and things that can happen to the pituitary gland and other stuff that can cause that, and some of them are serious too, and some of them are less serious. But that type of symptom is a ruptured aneurysm until proven otherwise. So that needs a brain scan right away and usually needs a spinal tap to prove that it's not an aneurysm that's bleeding, because aneurysms can leak a little bit and then seal off, and that's called a sentinel bleed. And then a day or a week or 6 months later, then they can rupture fully and cause a serious stroke or kill the person. And so that's a warning sign. That's a red flag. It's like, hey, red flag, whoa, look out, better work this up and find out what's going on. Then the other thing is onset after age 50, and we also use sometimes onset less than age 5. So if somebody has a new onset migraine at age 50 and they haven't had migraines before, that's not at all close to the typical pattern. So then we say, well, let's evaluate that. Let's make sure it's not a tumor or an aneurysm or something else, serious, because that's not a common time. There's another kind of headache called temporal arteritis that happens with inflammation of the blood vessels. And so that's a new onset headache. It doesn't fit migraine exactly, but it's one of the things you want to make sure somebody doesn't have when they have a new onset headache over age 50. Then there's 4 P's in this SNOOP P4. There's positional headaches. So headaches that are worse when you stand up, those are worse for low pressure headaches. So you stand up, all the fluid, the cerebral spinal fluid may drain out of your brain if you have a leak in your spinal cord. And that can happen after a lumbar puncture. It can happen after trauma where there's a tear around one of the nerve sleeve roots, and that can be repaired a lot of times. So headaches standing up are worrisome for low pressure headaches, and headaches lying down are worrisome for high pressure headaches. Like we've had some people in here who asked about pseudotumor or IIH, idiopathic intracranial hypertension. Same thing can happen if you have a tumor blocking off some of the fluid outflow from your brain. So that's called IIH, idiopathic intracranial hypertension, and a headache worse lying down is worrisome for a high pressure headache. Could be tumor, could be this IIH, could be a clot blocking some off, but you will want to evaluate that kind of headache separately. Then there's previous, that's the next P. So if a headache is different than your previous headaches, if you go along, you have migraine, 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 they seem to fit the same pattern, all of a sudden it's like, whoa, this is a new and different kind of headache. It's entirely different than what I've had before. That counts as a new headache that's worthy of evaluation. Then there's precipitated. So precipitated by Valsalva. So if people have new onset headache when they're lifting or straining or lifting weights or having sex or doing something where they're bearing down, that means that increases the pressure in the brain. And if that causes a headache, that fits a different pattern. And a certain percentage of people with that will have an underlying problem that, like we talked about, usually a vascular problem related to blood vessels, like an aneurysm or an atriovenous malformation where the blood vessels aren't formed right, or tumor or something bad. And that happens a high enough percentage of the time that it's worth working up to. And then the last one is papilledema. So when you see a headache doctor for an exam, they will always be looking in the back of your eyes, and that's where they can see the blood vessels, excuse me, but they can also see the optic disc in the back of the eye. And if that disc is bulging, instead of being flat or a little bit like a cup, if it's bulging out toward you, that means that there might be pressure from inside the brain pushing it out. So that's a sign of elevated pressure, and elevated pressure is a bad thing in the brain, causes headaches, causes a lot of other stuff. And if it's severe, it can even cause what's called herniation, where a part of the brain stem pushes down through the opening where it goes to the spinal cord, and that can lead to sudden death because it compresses the respiratory centers. So those are the kinds of things that we worry about for red flags. We're happy to have you here. Send us your questions. And Dr. Bob, over and out. Y'all take care.